Hello friend, myself Saurgupta welcomes you all in this session. Today we will discuss about the perception and its related disorder. So what is the perception and what are the disorders associated with the perception we will discuss in this session. So first of all we will learn about what is perception. We will learn its normal aspect, how the process of perception occurs while receiving an information. So, if we talk about the perception, the process of perception includes two phenomena. The first one is receiving of stimuli, and the another one is interpretation of stimuli. So here we see that the process of perception include receiving of stimuli. This is the first part, and the interpretation of the stimuli. It is the second part. Now we'll see the receiving of information. The process of receiving of information is performed by our sense organ. The receiving of stimuli, this process is performed by our sense organ, and as soon as we receive the information through our sense organ, the information reaches to the CNS via the nervous system. As soon as it reaches to the CNS, it is analyzed and where the information is identified. As soon as we identify the information, the process of interpretation completes. Now we will try to understand this phenomena with one example. For example, we have one object in front of our eyes. For example, it is a ball. As soon as we receive this information through our eye, the information reaches to the CNS where it is analyzed, and we analyze the information that this object is a ball. That means we have identified the information. But now imagine that you are seeing this information for the first time and you do not have any idea about this object. So what will happen? The process will occur same. You will receive the information about this strange object through the eyes. The information will reaches to the CNS, and where you will try to identify. Now you will try because you cannot easily identify the information because you are seeing this information for the first time. So now you will try to identify the information, and after as soon as you take efforts to identify the information, you reaches to the two conclusion, whether you will identify or whether you will not identify the information. So but you reaches to the some conclusion about this object. As soon as this process completes, that means your interpretation is complete. So now we revise this process again. The perception includes receiving of stimulus, and the second one is interpretation of the stimulus. Keep remember this point, interpretation of stimulus, as an important part of the perception because it will help us to understand about the illusion, which is an perceptional disorders or abnormalities. Now we'll see that we have discussed that we receive the information through our sense organ. So we have five type of sense organ in our body, that are eye, ear, nose, tongue, and skin. So these are the five sense organs we have in our body through which we receive the information, and each sense organ have a specific function. The eye has the function of vision, ear has the function of hearing, nose has the function of smelling, tongue has the function of to identify the taste, and the skin has the function to feel touch. The vision is related to the eye, and it is also known as the visual perception. So remember this terminology I am discussing over here. Visual perception is performed through the sense organ eye. auditory perception, the perception which is performed by the ear is known as auditory perception, which has the function of hearing. The function which is performed by the nose is known as olfactory perception. The function which is performed by the tongue, that is taste, is known as gustatory perception. And the function which is performed by the skin, that is touch, is known as the tactile perception. So why I am discussing over here? This type of perception will help us to understand about the sensory disorder, perceptual disorder, that is hallucination. So we will discuss about the illusion and hallucination in the further slides. Now we will discuss about the perceptual disorder. So we have two type of disorder. First one is illusion and second one is hallucination. So we will see it one by one. Illusion is otherwise known as misinterpretation, while hallucination is known as the false perception. So now we try to understand these terminology. Misinterpretation, that means we are having problem in the interpretation and the interpretation is miss is word used for the wrong. If we clarify this term, that means we are having the wrong interpretation. It means we have discussed about the process of perception, that means receiving of stimulus and interpretation of the stimulus. If we are try to understand the process of illusion, that is misinterpretation, that means wrong interpretation, that it means we are having disorder or disturbance in the process of interpretation. It otherwise mean that we are receiving the information. After receiving the information only, we can misinterpret the information. We can wrongly identify the information, but at least we should receive the information first. And if we are receiving the information, that means the stimuli is present. Stimuli is present, then only we are receiving the information. And if we are receiving only receiving the information, then afterwards we are wrongly interpreting the information. If we talk about the hallucination, we have written over here false perception. It means perception, the person is having perception, but it is false, which is not true. That means, which is not true. That means there is nothing in front of the person, stimuli absent. There is nothing in front of the person, but still the person is having perception. So we have justified these terms with the hallucination, that in hallucination we have false perception, while in illusion we have the misinterpretation. So this is the basic difference between the illusion and the hallucination. Now we will see what are the other conditions related to the illusion and the hallucination. So first we have understood that illusion is misinterpretation, hallucination is the false perception. Second one is, in illusion stimuli is present, in hallucination stimuli is absent. So this is the difference. If we go to the example, identifying a rope as a snake in the dark. So what is the example of illusion? The person identify a rope as a snake in the dark. That means the person is having the stimuli in front of him, but the person is misinterpreting the stimuli in a wrong way. While in hallucination, what can be the example of hallucination? That feeling or seeing a ghost or hearing a sound which are not felt by other. It means the person feel or see a ghost or hear a sound which are not felt by the other. If we ask to the other person in the surrounding that if whether you are feeling the presence of any person or if you are able to hear a sound, they will deny this phenomena. Only the person who is patient will justify or will force that he is able to see a person or image or she is able to hear a sound, but this perception will not be felt by the another person. If we talk about the illusion, this illusion can happen with many people. So if this phenomena can be felt by the many people, this illusion is considered as a normal phenomena, while the hallucination is felt only by the one people. So we can say the person is having disorders in their sense organ. So this is the example. I hope you understand the concept of illusion and hallucination. We will revise this topic again in the brief. So it is a very small topic and easy to understand. The perception has two distinct phenomena: receiving of is stimuli, and the second one is interpretation of stimuli. So as soon as we receive the stimuli through our sense organ, the stimuli reaches to the CNS where it is analyzed and we identify the information. So as soon as we identify the information, the process of interpretation completes. So here we discussed one example over here. This is one object, that is ball. We receive the information regarding the ball through the eyes. The information reaches to the CNS where we analyze the information. It is that this object is a ball and we identify the information. So receiving as well as identify the information, the process of perception completes. But we also discussed that if we are seeing this object for the first time, then what will happen? The process will occur same, but at last we will identify or will not be identify the information. But if still we are not identifying the information, we make some vague conclusion or we may make some wrong conclusion. So this is the process of perception. We have five sense organ through which we receive the information of outer world, and these function have a specific, these sense organ have an specific function. Eye has the function of vision, ear has the function of hearing, nose smell, tongue taste, and skin touch. Okay, oh I have wrongly written this word. It is not touch, it is touch. So these are the perception associated with the particular sense organ, and we have two kind of disorders related to the perception, that is illusion and hallucination. Illusion is the misinterpretation. That means we are having the object in front of us, we are having the information or stimuli in front of us, but we wrongly identify the information. While in hallucination we have the false perception, that means stimuli is absent but still the person have the process of perception. Example, we discussed also that feeling a rope as a snake in the dark in the case of illusion, and in hallucination the person will claim that he is watching a person or hearing a sound which is not which will not be felt by the another person. So this is the example, and illusion as well as it is felt by the many people, so we consider it as a normal process, while hallucination is an individual process because only one individual claims for what he is having perception, while the another person in the surroundings deny for these kind of perception. So we consider it as a disorders. The hallucination may occur in many psychiatric conditions. It can occur in the schizophrenia. It can occur in the schizophrenia. Yeah, delirium, dementia. We these are the example where the person may have the sense of hallucination. So this is all about this topic. I hope you got some important information through this video. If you like this video, please like and subscribe my channel, and thanks for watching this video.